Welcome, welcome, welcome to the 2020, or can we say 2020 CPT updates for psychiatry and behavioral health. My name is Dr. Dreama Sloan-Kelly. I'm a physician as well as a certified coder, and I am president of Dr. Sloan-Kelly Consulting. You can visit me on the web at www.drsloankelly.com. Also, my email address is dreama@drsloankelly.com should you need to reach out to me after this webinar is over with any questions or if you are looking for additional services. So it feels so weird. I've been doing this for so long. I mean, if I go back into my CPT update slides, it's just so weird to say 2020. But yep, we're still at it and we are still going to go forward and finding out what new updates, which there have been quite a few, we are looking at. So first, I would like to get through the business matters. Number one, you can download the handout that is attached to this course. It should be towards your left-hand side, and it should be come down in a PDF format. So once you get that, you can go ahead and download that. If you have questions after you listen to the webinar, you may submit your questions to questions@drsloankelly.com, like it is right there on your screen. And if you have any technical issues with the webinar, just go ahead and submit your problem to info@medicaltrainright.com. Also, there's a chat function that is also on the website. It does not mean that it's exactly going to work at that moment. However, if somebody is there and there's technical issues, they may be able to help you as well. So, are you ready for some fun? So this is a on-demand webinar. So you're able to go through the information at your leisure. It is pre-recorded. So if you do have questions afterwards, like I said earlier, you can go ahead and submit them to me via questions@drsloankelly.com. What I try to do is keep it upbeat and fun, like it always is for my live webinars as well. The one thing about CPT update webinars, they're not as much fun because there is a lot of information that you go over, and it's just kind of rote. So it's not something that you can just really sink your teeth into. So I just want to give you a little bit of forewarning about that. It's not like it's something that gets like real exciting and like, oh, like, debatable or whatever. It's just literally just the updates that are occurring and some of the little tidbits that I'm able to give you in regards to those. So with that said, let's go ahead and get started. So overview, there are new subsections added and new codes for online digital evaluation and management services provided by physicians and mid-level providers. One of the things that you're going to find that was a little confusing is that there's two different subsections when it's dealing with the online digital evaluation and management. What is a little interesting or confusing about it is the way that they use verbiage to define who is rendering those services. You're going to see where I point that out because actually when I was studying the codes to begin with, that was the number one thing that threw me off because I was sitting there and I'm like, what in the world is going on? Like, what are these people talking about? And then I actually went to other colleagues of mine and was like, hey, are you finding this to be a little weird? And they did, and this is one of the things that I will highlight for you so you don't have to go through that as well. The next one, the next area you're going to pay attention to with me are the guideline changes that took place in interprofessional telephone, internet, and EHR consultation sections. I will point those out. There have also been guideline changes in the psychiatric diagnostic procedures section. There are new codes and guideline changes in the health behavior assessment and intervention section. And then there's this huge other portion that came into play, and that's for telehealth codes for Medicare for the treatment of opioid use disorder. But it's actually a little bit more in depth than that. I'm going to go over it here. What I also did at the end was list some resources. There is an absolute link that I need you to look at the end after you're done with this. It's from MLN, Medicare Learning Network. And this is going to be helpful for you to understand this opioid use disorder treatment and seeing if your group or practice if it can apply to you and go through the process of getting certified so that you can provide these services too. So I think it's something that's going to be really valuable for you to look at. So first, we're going to go ahead and start up with our online digital evaluation and management services.